Greetings. Today we're diving into MOTS-c versus Retatrutide, which peptide actually aligns with your metabolic goals. Here's a question you will never hear in a standard doctor's office. Would you like to address your metabolic dysfunction at the mitochondrial level, or would you prefer a pharmaceutical-grade approach that targets multiple hormonal pathways simultaneously? What you'll get is a blank stare and possibly a BMI calculation, a pamphlet about portion sizes, and a gentle suggestion to try walking more. The standard of care for metabolic health is, in clinical terms, a disaster, perhaps worse than that. It is non-existent. And the people who have quietly been doing the actual work of figuring out how metabolism really functions have been doing it in the peptide space, specifically with compounds like MOTS-c and Retatrutide. There are many peptides, several thousand that have been identified so far, and 30 to 40 that are in regular use. MOTS-c and Retatrutide work through entirely different mechanisms, targeting different aspects of metabolic dysfunction, and are appropriate for very different situations. Understanding the distinction is the difference between using the right tool and swinging a hammer at a problem that requires a scalpel. Let's get into it. I'm the digital avatar of Dr. Max MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He uses AI to save time, allowing him to focus on helping others. With over 45 years of clinical experience, he has developed extensive, specialized health knowledge he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now let's get back to today's topic, but before that I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. MOTS-c is a mitochondria-derived peptide. It is encoded not in your nuclear DNA, where most of your genetic instructions live, but in the mitochondrial genome itself. This alone should tell you something interesting is going on. When MOTS-c is active, it functions as a metabolic regulator at the cellular level. It improves insulin sensitivity, promotes fat utilization as an energy source, enhances mitochondrial function, and has been shown in research to extend lifespan and physical performance in animal models. Think of it as a direct communication signal from your cellular power plants to your metabolic operating system, telling the body to burn more efficiently, waste less energy, and respond to insulin the way it was designed to. MOTS-c is not a weight loss drug, it is a metabolic optimizer. The distinction matters enormously. Someone using MOTS-c is not suppressing appetite or forcing hormonal changes through a pharmaceutical override. They are providing a biological signal that the body naturally produces in declining amounts as we age and watching their metabolism respond accordingly. Who is it right for? Someone with declining energy and metabolic efficiency, early insulin resistance, a desire to improve physical performance and body composition without aggressive pharmaceutical intervention, or someone building a comprehensive longevity protocol who wants mitochondrial optimization as a foundation. Note that mitochondrial dysfunction is one of the true root causes of aging and all chronic diseases. Part of that involves damage to the inner mitochondrial membrane. For that reason, it is best to combine MOTS-c with another peptide that helps to repair that damage, SS31. You don't want to ramp up activity and damage mitochondria without first repairing damage to a critical component. Retatrutide is a different animal entirely. It is a triple agonist, meaning it activates 3 separate hormonal receptors simultaneously, GLP-1, GIP, and glucagon. If semaglutide, a single GLP-1 agonist, produces 15 to 20% body weight loss, Phase 2 trial data for Retatrutide showed weight loss approaching 24% at the highest doses over 48 weeks. That is, by the standards of pharmaceutical weight loss, extraordinary. GLP-1 receptor activation suppresses appetite and slows gastric emptying, the same mechanism as semaglutide. GP receptor activation enhances insulin response and may reduce some of the GI side effects associated with GLP-1 only drugs. Glucagon receptor activation increases energy expenditure. Your body literally burns more calories at rest. The combination produces weight loss results that are substantially more aggressive than anything previously available in the pharmaceutical category. It also comes with the same fundamental disclaimer as all GLP-1 class drugs. It is a tool, not a solution. Muscle preservation, nutritional strategy, and a plan for transitioning off the peptide are not optional extras. They are the difference between a successful metabolic intervention and an expensive yo-yo. This is where most online comparisons fall apart, because the honest answer is, it depends on what you're actually trying to fix. If you are 20 to 30 plus pounds overweight, metabolically compromised, and need a meaningful body composition change in a medically supervised context, Retatrutide is a powerful tool to consider. It is not subtle. The results are aggressive, the mechanism is multi-pathway, and the requirement for smart co-management is correspondingly higher. If you're relatively lean, already engaged in optimizing your health and longevity, dealing with declining energy and metabolic efficiency, or looking for a cellular level upgrade that doesn't involve suppressing your appetite or overriding your hormonal system, MOTS-c is a fundamentally different and more elegant intervention. The other key difference, MOTS-c has a decades-long safety profile emerging from mitochondrial research and is considered part of the body's own signaling architecture. Retatrutide is a newer peptide pharmaceutical compound with compelling short-term data and a side effect profile that warrants medical supervision and honest pre-treatment conversation. At the Age Reversal Technology Center in Sarasota, we don't recommend peptides based on what's trending on social media. We assess your complete metabolic picture, hormone levels, insulin sensitivity, mitochondrial health indicators, body composition, and health history, and then recommend the approach that matches your actual biology and goals. For some patients, that's MOTS-c as part of a broader longevity and optimization protocol. For others with significant metabolic dysfunction and meaningful weight loss goals, Retatrutide or another GLP-1 class compound may be more appropriate, always within a supervised framework that includes nutritional strategy and muscle preservation. For many, it's a combination, because the body doesn't operate in single peptide silos, and neither do we. Stop guessing. Stop reading Reddit threads, comparing before and after photos from people whose metabolic situation has nothing to do with yours. Call us at 941-806-5511, stop by 6968 Professional Parkway East in Lakewood Ranch, and let's figure out what your metabolism actually needs. Your mitochondria have been trying to tell you something. It's time to listen.